Welcome. My guest is Dr. Roger Briggs in Scottsdale, Arizona. Today we're discussing sleep dentistry. Dr. Briggs, it's always a pleasure. Thanks for joining us.
Thank you. It's good to be here.
Well, it's becoming more common now for dental professionals to play a part in the diagnosis of sleep disorders. How do you diagnose a sleep problem?
Well, you know, the airways, we're looking right at the top end of it. And things that can block the airway are the tongue and the back of the throat, the shape of the back of the throat, muscle tone in a patient, the amount of weight the patient has. All those things are things that can be a red flag. And so patients, especially when they first come to us, are surprised that we're even looking for those things. You know, I remember years ago when we started really examining a patient's mouth and oral cavity and throat for cancer, patients were surprised that we do that. And now if you don't do that, patients are surprised if you didn't do it or disappointed that you didn't do it. So when we start looking for overall health conditions, we can see by some of those factors that I just laid out that there may be an issue. Technology has really come a long ways. In the old days, I say the old days, just a few years ago, in order to have that measured or tested, you had to take your teddy bear and your pillow over to a lab, and it was a big deal. They hooked you up to more wires than it took to launch a spaceship out of NASA. Now we can simply send you something that's about the size of a cell phone. You hook it up, you have a little thing on your finger that tells about your oxygen, and we can measure those things, and you bring it back the next day, we plug it into the computer, and it gives us very accurate diagnosis of how many apnea episodes that you had, or what time of the day, or how your sleeping may affect your apnea. So we can get a lot of information that's very, very accurately diagnostic just from a simple home sleep test.
And now with regards to your practice and dentistry overall, talk about treatment modalities.
Yeah, I can unequivocally, people think if they have sleep apnea that they've got to wear this vacuum cleaner on their face. Now that's not always the case. One of the governing bodies of how sleep medicine is, the protocols of sleep medicine, is the Academy of Sleep Medicine. And they had a position paper, I think it was in 2006, that recognized that for mild to moderate sleep apnea, that maybe an oral appliance was preferable over the CPAP because the compliance rate with the CPAP is pretty low for a host of different reasons. But the oral appliance is pretty high. Now, when that oral appliance is made, the FDA has approved, I think we're up to about 96 different oral appliances now that are approved by the FDA. Of those, of course, the bell curve applies, and there's a few of them that I believe in my practice are the most successful. So those oral appliances, patients are often really surprised that can be treated with something as non-invasive as a mouthpiece.
Obviously, the symptoms of sleep disorders manifest themselves while one is asleep. What are some of the symptoms that someone might recognize?
Yeah, some of the things, and these are things that a patient can look at home. You open real wide and see if you can see past your tongue. If you can't see your airway, then you've probably got a higher risk of having an obstruction in your airway. It's a funny little word. It's called a melon patty score. And I always tell people, if you want to Google some fun stuff, go Google melon patty. You know, some of the information that we get too doesn't come from just looking at the throat, but with a thorough health history, medication history. We can learn a lot about some of the possible symptoms people are getting, where acid reflux is a common one. I think, as I recall, somewhere around 30% of the acid reflux out there comes from obstructive sleep apnea. And so if we can open the airway up, and we're not pumping our chest and stomach back and forth against each other, we're not pumping acid up out of our stomach into our airway. So there's a lot of information gathered from not just looking, but looking at health histories and medications.
All right, Dr. Briggs, thank you.
Thank you, Scott. It's always a pleasure.
My guest has been Dr. Roger Briggs in Scottsdale, Arizona with Briggs Cosmetic and Family Dentistry. Thanks for watching.